a healthy smile actually starts with good habits. We should have good oral hygiene habits, which is 2 times 2. That means you should brush for 2 minutes 2 times a day. Preferably, before going to bed, you brush, so that in the morning, it's actually supposed to be you brush your teeth after breakfast because you've already brushed at night and you've not eaten anything prior to that breakfast. So what do you need when you want to brush your teeth? It's advocated that we use fluoride toothpaste to keep our enamel strong and healthy. The enamel is the outer covering of the teeth. That's what appears white. So fluoride, it helps keep the tooth white. Then a new brush. You should replace your toothbrush every 3 to 4 months. Once it's 3 months or 4 months, that toothbrush should be discarded. A new one should be gotten. Then we floss. Flossing is a way of removing other tiny things that get in between our teeth that the toothbrush might not be able to remove. So dental floss comes in the form, it comes like a string. You actually use it to remove the dirt that has gotten stuck in between your teeth. So 2 minutes twice a day, oral hygiene. Next slide. The next one is hand washing. Hand washing is very, very important when it comes to personal hygiene. We know we use our hands for virtually everything that we do. We use our hands to write, we use them to play, we use them to cook, we use them when we go to the toilet. So it's very important that we wash our hands properly so that we don't spread germs, so that we don't carry germs from one point to another and to other things like our towels and our bed sheets and even surfaces. So how do we wash our hands? So we can wash away germs in just 5 simple steps. The steps are 1, wet, 2, lather, 3, scrub, 4, rinse, and 5, dry. So you wet, you use clean running water preferably. Then you turn off the tap. You put your hands under the running water. It might not be a tap, it might be there's something we call a Veronica bucket. It's a bucket that has a tap attached to it. So you open it and let the water soak your hands, then you turn off the tap. The next is to lather. You take soap, you rub the soap at the back of your hands, inside your palms, in between your fingers, and under your nails. And you rub it to create a lather. Lather is what we call foam. When you put soap and it creates foam, that's lather. Then the next thing you do is what? You scrub. That means you should rub your hands, rub your 2 hands together, in between your fingers, behind your hands for at least 20 seconds. Then after doing this for at least 20 seconds, you now rinse. That is, you wash all the bubbles, all the soap away. Then the last stage is to dry. You use a clean towel or you air dry. And the simplest way to ensure that you spend the minimum time you require to wash your hands is by humming "Happy Birthday to You" twice till the end. That will give you approximately 20 seconds. So you wet your hands, you lather them, you scrub, you rinse, and then you dry. Next slide. So the next is bathing or taking care of our body. So daily showers keep you feeling fresh. The signs of freshness. I don't know if we know this. The body odor, what we call bromhidrosis, happens when bacteria break down sweat. We know as teenagers, there are a lot of changes that are going on in our body. As such, we tend to sweat more. So when the sweat mixes with bacteria, those bacteria breaking down the sweat is what causes that body odor. So how do we take our daily showers? How do we take care of ourselves? We should have daily routine showers. That's shower or bath daily with soap and water. This rinses away bacteria. Then we can stay fresh by applying deodorants to our dry armpits. We don't apply deodorants to wet armpits. We make sure we pat dry our armpits before we apply deodorant, or what most of us know as roll-on. Then thirdly is hair care. We should wash our hair with shampoo at least once a week. That's for those that are not active. If you are the type of person that does exercise, or maybe you are in the school football team or basketball team, you do a lot of sports, you might have to wash your hair more than once a week. Then there are some areas that we need to pay attention to because those areas tend to accumulate sweat. Those areas, we call them the sweat zones. They include the armpits, in between our toes, and the groin area. The groin area is the area between your waist and in between your thighs, where the genital area is. Next slide. So the next thing we're going to talk about is intimate hygiene. Intimate hygiene means hygiene of our intimate area. The intimate area is our genital area. So God created our body in an amazing way. The intimate area has two parts. We have what we call the external genitalia. That is what we see on the inside. Then we have the internal genitalia. Dr. Bakar is going to take us through anatomy. I'm just saying this so that we understand. The internal genitalia is where the vagina and the other reproductive organs are, while the external genitalia is the part that we see outside, which has the pubic hair, the labia, and the clitoris. So the female genital tract is actually amazing. The internal female genitalia is self-cleaning. The vagina cleans itself. So because of this, we should take note of the following, that there's a natural balance. The vagina and the vulva produce natural fluids that keep everything healthy and balanced. On their own, they've been designed to clean. Then the vagina has a natural scent. It has a natural smell. A healthy vagina has a slight natural odor, so don't try to eliminate it by washing, because there are different types of odors. There are some that are natural and there are some that might be a sign of disease. So if you try to eliminate the natural odor, you might actually tamper with the normal organisms that are helping to keep that vagina healthy. Then, as I said, the vagina is cleaning. Washing it won't remove infections, and it may even make them worse, because you shouldn't insert anything into the vagina. It's only the outer, the external genitalia that should be washed. Then we should also always remember that safety first. We shouldn't use harsh soaps because they dry out the delicate tissues of the genital organs, causing tiny tears that may actually increase the risk for infections. So we should remember that there's a natural balance which takes care of cleaning. It has a natural scent and it's self-cleaning, and we shouldn't introduce things that actually cause harm to our intimate area. Next slide. So how do we care for our most delicate areas? We'll see that I highlighted this in two boxes. The safe way, which is highlighted in blue, and the unsafe way, which is highlighted in pink. So what we are supposed to do is to wash the external area, that's the vulva, where the pubic hair is, the labias are, and we should wash it with warm water only. We can see we didn't say soap. And if we have to use soap, we should make sure it is mild and unscented, because it's only the outside that we are washing. We don't want the soap to go inside. Then rinse thoroughly with clean water, and you pat dry gently with a clean towel. It's very important to dry the intimate area after washing, because leaving water and then putting on your undies, your panties, can actually predispose to growth of other organisms. So anytime you clean or you wash after doing a bath or after using the toilet, you should dry the area. And we should also remember that we clean from the front backwards. You clean the front before you go to the anal area. Anytime that you're washing, whether it's after using the toilet, maybe urinate and pass through, you should first wash the front before you go to the back, so that you don't carry organisms from the anal area back to the vaginal area. Then what are the unsafe ways? Putting soap inside the vagina is unsafe, because as I said earlier, the vagina is self-cleaning. If you introduce soap, you might introduce other chemicals which will irritate it, and then it might also disrupt the normal function of cleaning. Then using scented feminine hygiene sprays or wipes is also unsafe. Then douching. Douching is actually inserting things into the vagina. It disrupts the natural healthy balance, because there are organisms that naturally maintain the pH of the vagina, the lactose bacilli. So if we introduce things into the vagina, it might actually disrupt them. So now I'm going to talk about some of the myths and misconceptions that we have about personal hygiene. So let's clear up some of these common misconceptions. The first one is what? That daily showers are essential for everyone to stay clean. That's a myth. What's the truth? Overshowering can strip natural oils. Most only need it every 2 to 3 days unless sweating heavily. So despite that we bath daily, you can actually go for up to 2 to 3 days without taking a shower and it won't cause any harm. Then the second is the 5-second rule, that any food that drops on the floor is safe once it is picked up within 5 seconds. That's a myth, because bacteria is transferred immediately that food touches the ground. So surface cleanliness matters more than the time spent on the floor. The third myth is what? That peeing in the shower is harmless because urine is sterile. There are some people that have the habit of they urinate anytime they go into the shower. So what's the truth? Urine can contain bacteria and may contribute to plumbing hygiene issues over time. It will build up in the plumbing and cause issues. Then another one is cotton swabs are the best way to clean your ears. You know, a lot of us use cotton buds, cotton swabs to clean our ears. Actually, those swabs push wax deeper into the ears. Ears can clear themselves naturally and just clean the outside with a towel. Then the next one is what? That hand dryers are cleaner than paper towels. Actually, hand dryers, they can disseminate bacteria into the air. Paper towels are actually, they are better because they reduce the spread of germs and they are more effective. Then the next one is that bad breath only means you are not brushing enough. This is not true. Bad breath can actually be a form of, it can occur from dehydration or from food or from drinks. So you need to drink plenty of water to stay hydrated. Dehydration can actually cause bad breath. So this is like a personal hygiene checklist to summarize all that we've said from the beginning. We said we should brush twice a day, right? At night and after breakfast, and we should floss once. And we should wash our hands for 20 seconds. I said we can hum the happy birthday to you song to the song twice. That will give us approximately 20 seconds. Then daily shower and fresh clothes. Then gentle external only intimate care. We only wash the outside. We don't put anything inside our intimate area. Then stay hydrated, and we should listen to our body. Hygiene is about health, not just looking good. It actually contributes to